Well, think about it. She probably has had pain there all her life. So we're trying to teach her that, hey, guess what? The reason you went through this is so that you wouldn't have pain there. That's all of my toughest FHO patients are the ones that have had a long history of hip pain, because they just don't believe, they went through this surgery and they still have pain because they have post-surgery pain.
Right.
So they don't know that anything's been fixed. They don't realize that has actually been corrected. Some of them discover it right away. They make a mistake and they step on it and you go. And others, it takes a lot of time. I've actually had the opportunity to see a few of them where the light bulb went on, where I was actually doing something with them here, and they all of a sudden, you could just see, they went, oh wow, that didn't hurt.
Now she's only been limping like since May.
Only since May. And how old is she?
She's 14 months.
Ooh, okay, so only a fourth of her life.
Oh, okay, yeah.
Yeah.
Okay.
See, that's what you have to do.
Yeah.
You have to think of it as timeline.
Okay.
Yeah, she's only been limping since May, and it doesn't seem that bad because she was already 10 months old or
Right.
9 months old
Right.
when it started. But when you look at it in her memory of the first 6 months of her life is probably very, very small. So half of her life that she remembers, half of her more recent life that she has memory of was in pain.
Right.
So it's still, it's still pretty significant. She can be tricked into touching it down, but she immediately starts to, see what I'm doing right now is I lowered her body so that her foot was touching the ground, and I put my thumb on top of that foot. So I'm not letting her pull away. And actually, because I'm being really gentle about it right now, she's not fighting me. She's not trying to slip her foot out from under me. So she's already learned that I'm not trying to hurt her. She just hasn't figured out what it is I am trying to do with her. But I would make her walk more.
Okay.
Because she's capable of walking now, so we want her to discover that she is capable of walking.
Right.
So you can pick her up and carry her, obviously, because that's part of the relationship that you have with your dog.
Right.
But I would minimize that until she's walking. Once she starts walking again, you can do whatever you want.
Right.
She can be in your arms all the time. But until you get her going, you don't want to have done this surgery just to eliminate pain. You want to do it to help make her life fuller and
Absolutely.
and more mobile.
Yeah.
So you can see who holds her more, right?
Well, that's nature. Actually in our household, I think I spend more time nurturing the dogs. My wife really loves them and she wants them to be nearby and she interacts with them a lot. But I'm the one that'll groom them, that'll give them the belly rubs. Because I was a massage therapist for years, I tend to sit there and I'll massage my dogs, especially my show dogs, while I'm laying around, while I'm watching TV and they're laying next to me. I'll just slide down and start massaging and working their joints and stuff. So, there's always one in the household that does more nurturing than the other,
You're okay, Bella. You're okay.
But what we're going to do now, because I know this is really, really good for tissue healing, is I'm going to do a cold laser treatment. This may be the shortest cold laser treatment in history, because the reason I got this laser is because it used to take me, with my old laser, it used to take me, to treat a dog like this would take about 12 to 15 minutes. With this laser, it's going to take about 2 to treat her. And it's also cold laser, so there's nothing, you don't feel anything while you're doing the treatment. You just get the results of the treatment.
And what does it do?
It stimulates tissue healing. I first used laser to treat wounds in the burn unit at Flagstaff Medical Center. And that was back in the mid-90s. Lasers have come a long way. Now we can use them for nerve tissue healing, bone healing. We're mainly going to do this not to heal the sutures, although it will help that. We're mainly going to do this to flush any residual inflammation or swelling that might be underneath there, to flush it out and to stimulate below the surface tissue healing. This laser is strong enough, it will penetrate all the way through her. I could probably actually treat my toe on the other side, because it has a penetration depth of about 3 1/4 inches, and she's probably only about 3 1/4 inches deep. So, you might, if she tends to do this, like walk around in front of you when you're sitting at the sofa and things like that, what I would do is I would put down some little objects like little pieces of PVC pipe or rolled up hand towels or something like that, where it makes the surface uneven and makes her think about stepping over objects,
Oh, I see.
especially while she's focused on you. You know, she's
Oh,
looking up
okay.
at you and having to step over objects. Well, that tends to push the weight backward.
Sure.
Weight shifts her to the rear and encourages her to put the foot down. Because look at her, as soon as she puts her head up, the foot drops another half an inch.
Right.
There, actually, she's toe touching now because she's
Right.
focused on you.
Right.
So those are the things you want to do. Look at her. She's going to be doing two-legged games any second.
She wants to do it.
Oh, she's so close. Say up, up. Come on, Bella. Up.
It's very hard. All right, Bella.
Now
Are you
her-
ready to swim?
Her brother, of course, we've been trying to keep him.
Yeah, and that's a good idea, at least for another week or two. Until she starts using the leg consistently, you want to avoid any traumatic impacts, any risky behaviors.
Roughhousing.
Yeah, it's all about risk. I mean, it really is. I teach people how to successfully exercise their dog and do it with minimum risk. That's the trick.
Cool.
Okay.